You're much welcome at Medical Sciences, as we are always privileged to have you to learn from us. As we always remind you to subscribe, hit the like button, and share to others. And in this session, we want to discuss introduction to cell injury. We want to see if there is a normal cell and there is a change in the stimuli. How does cell respond? And even how does injury come about, both reversible and irreversible? And then later we shall focus on cell adaptations in the case of injury. So we want to see cell injury, but before we begin the mechanism, we need to know what causes cell injury. So we want to start with the causes. Causes of cell injury. And causes of cell injury include, they can be genetic, they can be physical, they can be chemical, they can be nutritional, they can be even immunological causes, and finally we shall see infectious agents, what sometimes we can refer to as biological causes. So these are the major causes of cell injury, whereby genetic is due to change. This one can be due to mutation or change in the chromosome. Change in chromosomes leading to inherited disorders. And these inherited disorders can exert stress to the injury. Then physical causes include heat, which is the same as temperature, includes radiations, include mechanical injury like trauma in the case of mechanical injury. So these are some of the physical causes, and even increase in pressure. When there is increase in pressure, that is physical causes. Whereas chemical causes, we shall see drugs, toxins, poisons, being chemical causes of cell injury. Whereas nutritional imbalance, this is nutritional imbalances. Here is due to deficiency of essential nutrients, such as vitamins, deficiency of nutrients like proteins, whereby we shall see when the proteins are low, that is kwashiorkor, marasmus in the presence of carbohydrates, then vitamins. So in the case they are deficient, they can also bring in cell injury. Then immunological causes, this is as a result of exaggerated or what we call allergic reaction or hypersensitivity reactions due to antigen antibody reactions, or they can be cell mediated. And these ones normally result into what we call autoimmune disorders like systemic lupus erythematosus, like rheumatoid arthritis, as a result of immunological changes. Then infectious agents, we have infectious or biological agents like bacteria, viruses, we have fungi, we have protozoans. So all these can cause cell injury. So after seeing the causes of cell injury, now we want to see what happens in the case of this injury. If I have a normal cell, and this normal cell is subjected to these causes in presence of a causative agent, this cell can respond either by adaptation, can adapt in case if the stress if there is limited stress or when there is low stress. When the stress to the normal cell is low, we see adaptation of this cell, and in case the stress is high, we can see this cell undergoing what we call cell injury. And this cell injury is categorized into, whereby under cell injury it can respond either by irreversible cell injury or reversible cell injury. Under irreversible, we shall see when it is irreversible, it undergoes into what we call cell death, which is the result of either apoptosis, which is a programmed cell death, or it can undergo necrosis, as we shall see it in the coming video. Then if it is reversible, we can see changes which are reversible in a cell, like fatty changes, like in the case of a fatty liver disease. We can see accumulation of pigments in the tissues, pigments like melanin, like hemosiderin. They can accumulate, like bilirubin accumulating in the tissues. So these are forms of reversible cell injury. Then adaptations, we shall see different adaptations to cell injury, to stress. Here we said the stress, when it is high, it can when it is high, it results into irreversible. Then when it is moderate, it results into reversible, then irreversible when it is very high, when the stress is high. And when it is low, it results into cell adaptation, which shall include hyperplasia, shall include hypertrophy, then hyperplasia. We shall see atrophy and metaplasia. And sometimes we also discuss about dysplasia. So these are the adaptations. So after seeing the causes of cell injury, then we discuss the mechanism, how cell injury comes about, and how, if it is the stress is low, how adaptations come in. Now in the second half of this video, we are going to discuss about cell adaptation to injury. So in this session, we want to look at cell adaptation, and we want to see how they are. And the number one, as we have listed it here, is hypertrophy, whereby hypertrophy, this one occurs in cells that do not undergo cell division. They do not undergo cell division, and it is characterized by increase in size of cells. So there is increase in size. So in these cells which do not undergo cell division, like the cardiac muscles, we see them increasing in size, and what increases size is due to increase in cellular organelles, or increase in cellular components. So the cell do not divide, but the cellular organelles multiply or increase in size or in number, but without dividing the cell. And that is why we see increase in size. And the major cause of hypertrophy is always due to increased workload. When there is increased workload to muscles of the heart, like in the case of hypervolemia or increased blood volume, we see the cardiac muscles undergoing hypertrophy, and even skeletal muscles. If when there is increased workload, and even when there is increased hormonal stimulation can result into hypertrophy. Then the second adaptation mechanism we can discuss is hyperplasia. And this hyperplasia, for it occurs in dividing cells or in cells which are capable of undergoing cell division, and it is due to hyperplasia is due to increase in number of cells. So in hypertrophy is only increase in size without dividing the number, but in hyperplasia is increase in number of cells. And these cells which undergo cell division, they can undergo both hypertrophy and hyperplasia. But only those which do not undergo cell division, they only undergo hyperplasia. But these ones which can do cell division, they can have both hypertrophy and hyperplasia. So this is due to increase in the number of cells, and the causes can be also due to increased workload and hormonal stimulation. So the causes are the same as hyperplasia, as hypertrophy. Then the third one we can discuss about is atrophy, whereby atrophy is decrease in size of cells. We saw hypertrophy was increase in the size of cell, but this one is decrease in size. And this atrophy can either be physiological, the causes can be physiologic, or they can be pathological. And the physiological cause, we see them being very important, like during embryonic life, the development of the notochord, it disappears or it undergoes atrophy. And also we see when pregnant women after delivery, the uterus undergoes atrophy. So this is very important when they undergo atrophy. Whereas the pathologic cause of atrophy, these ones, the pathologic causes can either be due to nutritional imbalance, or it can be due to, so there are many causes of pathologic atrophy, or like decrease in workload, even also due to lack of nerve supply, lack of nerve stimulation, even atrophy can be as a result of lack of hormonal stimulation, and even this one also lack of immunologic. So there are many causes of, or what you call pathologic causes of atrophy. In case you are not feeding well, it can occur. In case you're not doing any exercise, you are not, the organ which was doing the work is no longer being done, can undergo atrophy, or due to lack of nerve supply, due to lack of blood supply, even a blockage of lack of blood supply can also be due to a cause of pathologic cause of atrophy. So these are the different causes of atrophy, both physiological and pathologic. Then lastly, as we conclude in this session, we can look at metaplasia, whereby metaplasia is number 4, cell metaplasia, whereby in metaplasia we see differentiated cells, whereby different cell type is replaced by another cell type. by another cell type. And the common example in metaplasia is always the replacement of columnar epithelia by squamous at the cervix or at the cervical area. The cervix, at endocervix, whereby we see, in the case of endocervical cancer, we see columnar cells being replaced by the squamous cells, what we call squamocolumnar at squamocolumnar junction. So the columnar cells, we know that at the cervix, in the inside part of the cervix, they have columnar cells, but these columnar cells are being replaced by the squamous, which is a peculiar example of metaplasia. Meta means one cell type is replaced, or it is replaced by another type. And then dysplasia, which is number 5, dysplasia of the cell, and even sometimes they undergo neoplasia, but neoplasia is sometimes irreversible. But dysplasia is loss of function, but which is not more peculiar of adaptation. So the major for adaptation is hypertrophy, hyperplasia, atrophy, and metaplasia, whereby you have said hypertrophy is increase in size in cells which do not undergo cell cycle and is due to either increased workload or hormonal stimulation and other growth factors, whereas hyperplasia occurs in cells that are capable of cell division. So cells that are capable of cell division can undergo both hypertrophy and hyperplasia, and it is due to increase in number, and we saw the causes can be due to hormonal stimulation majorly. Hormones, increase the hormonal production, and an example here we can see hyperplasia due to increased production of estrogen. It causes increased number of cells in the uterus. Then when during menopause, that lack of hormone like estrogen can lead to atrophy. Then we have seen atrophy, which is decrease in size, which is both physiological and pathologic, and we have also seen metaplasia. Thank you so much for learning with us. We are always privileged and we always remind you to subscribe, share your comments, and like the video. May God bless you.